USMLE style question, Ampulla of the fallopian tube. Question: a 32-year-old woman presents to the emergency department with sudden lower abdominal pain and vaginal bleeding. She has a positive pregnancy test, but has not had an ultrasound yet. Transvaginal ultrasound reveals a gestational sac in the ampulla of the fallopian tube with no intrauterine pregnancy. Which of the following best describes the significance of the ampulla in early pregnancy? A. It is the site where the blastocyst implants into the endometrium. B. It is the most common site of fertilization. C. It is the site where the morula forms. D. It is the site where the secondary oocyte completes meiosis II. It is the most common site of ectopic pregnancy implantation. Answer and explanation. Correct answer: B. It is the most common site of fertilization. The ampulla of the fallopian tube is the widest and longest segment and the most common site of fertilization, 70% of cases. Why are the other options incorrect? A. It is the site where the blastocyst implants into the endometrium. Incorrect. Normal implantation occurs in the uterus, endometrium, not the ampulla. If implantation occurs in the ampulla, it leads to an ectopic pregnancy. C. It is the site where the morula forms. Incorrect. The morula forms by day 3 to 4 in the isthmus or uterine cavity, not in the ampulla. D. It is the site where the secondary oocyte completes meiosis II. Incorrect. The secondary oocyte completes meiosis II only if fertilized, but fertilization occurs in the ampulla. Completion of meiosis II happens inside the oocyte itself, not due to the ampulla's location. E. It is the most common site of ectopic pregnancy implantation. Incorrect. The ampulla is the most common site of fertilization, not implantation. However, if an ectopic pregnancy occurs, it is also the most common site of ectopic implantation. Key learning points. The ampulla is the most common site of fertilization. Ectopic pregnancies often implant in the ampulla, but normal implantation happens in the uterus. Meiosis II is completed only if fertilization occurs. The morula forms later in the isthmus or uterine cavity. Would you like